So good evening, everybody. CNBC-TV18 and IIT Delhi welcomes you to Health X Conversations, presented by Optum. I'm Mugdha Kalra, and I'm absolutely delighted to be here at the prestigious IIT Delhi campus. We are proud to partner and collaborate with IIT Delhi for this very special occasion today. We are all at a crucial turning point in the evolution of healthcare. Challenges such as accessibility, affordability, and the demand for improved outcomes are significant. But so are the opportunities. With technology shaping the world, healthcare is moving beyond traditional care delivery. It is now about prevention, personalization, and proactive care. Optum India, the Global Capabilities Center of UnitedHealth Group, a Fortune 4 company, is committed to helping people live healthier lives while improving the health system for everybody. And with over 2 decades of their presence in India, Optum's talented workforce continues to create value and deliver quality outcomes across the entire health care landscape. Through a powerful combination of healthcare operations, advanced data analytics, and technology, Optum drives innovation that enables a simpler, more accessible, and affordable healthcare ecosystem. And that's exactly the spirit of Health X Conversations. It is a platform created to spark a meaningful dialogue and drive actionable solutions for a more inclusive, smarter healthcare system. More importantly, this initiative is about nurturing leadership and a sense of innovation, a spirit of innovation that can help redefine the future of healthcare industry.
At IIT Delhi, we are keen to see that we have excellence in education and research, and that the knowledge that we create makes an impact in society. And what better field than healthcare, because it impacts people's lives directly. We have the the ICMR has funded M-Pragati, which is we've got characterization and fabrication equipment to create a medical device innovation ecosystem in the country so that we can actually build innovators and new startups to do this. We are actually looking at ways in which AI, computer vision, and all of this comes along with healthcare. And for us, it is really a pleasure to be co-hosting this dialogue. And we are delighted to have with us Mr. Sandeep Dadlani. We are delighted that you have agreed to come and speak to us at on this forum. We are waiting to look at ways in which we can have the convergence, ways in which we can really accelerate and create innovation that makes a difference and bring the new healthcare, which is accessible, affordable, and take the technologies forward. So I'd just like to say that IIT Delhi would like to interface with all of you and hope that we can catalyze an innovation ecosystem in healthcare in the Delhi NCR region, which is globally competitive and which actually leads the way. So with these few words, I'd like to welcome you once again to IIT Delhi. Thank you.
Welcome to IIT Delhi. I'm just going to continue telling you a little bit more about the ecosystem at IIT Delhi after Professor Rangan Banerjee introduced to you. So healthcare, as Professor Banerjee said, has been one of the topmost areas where IIT Delhi is investing in. Out of the 6 areas, healthcare system, medicine, and medical devices have always been at the forefront of research in IIT Delhi. The overall vision of the institute actually has been to contribute to India and the world through excellence in scientific and technical education and research. And that actually forms the philosophy of what we are doing today at IIT Delhi. If you look at our efforts in our healthcare, what we've done is in the last 5 years, we have also dedicated a brand new building to healthcare research, which is called the 99C, or the building which you must have seen while coming from the the main gate on the campus. This building is dedicated to healthcare research, and it is going to house the research laboratories. It has a clinical room. It has an MRI facility, cryo-EM, and other high-end infrastructure. This also tells you how serious we are about healthcare in IIT Delhi.
Well, there are three kinds of people in the audience. One group, category one, is like, I'm an engineer, but do I really want to join healthcare? I don't understand healthcare. That's the medicine people. They're going to spend 15 years studying. I'm getting out in 4 years and getting a job. I don't have 15 years. I don't understand healthcare. I'm intrigued. I'm curious. The second category of people are like, I don't know about placements this year. I'll take any job I can get. Anybody in the second category? There's some half hands there. There you go. Yeah, slowly. Yeah, scared. Whatever job I get, I'll take it. And then there's a third category who were just passing by the lobby and saw a lecture. So now you're in and now you're stuck for the next hour or so. How many in the third category? There are a few. You won't admit it. So category one, curious. Category two, indifferent. Whatever job I get. Category three, let's try and first convert category one. Right? Engineers who are curious but not sure what will an engineering person do in healthcare. Let me give you my story. I'm an engineer. I've worked all my life in Citibank, in Infosys, in Mars, and now in UnitedHealth Group. I joined UnitedHealth Group 2.5 years ago, and I said, oh my God, I have banking, I have consumer industries, I have tech. I am going to transform healthcare. How do these people know how healthcare is run? And I said, first, let me try and understand all healthcare experiences and apply my banking, my consumer industry, and my tech knowledge and transform healthcare. I walk into a call center, UnitedHealth Group gets 300 million calls a year from Americans asking questions. What am I eligible for? Am I eligible for an MRI for the second time for the same? Am I eligible for acupuncture? Am I eligible for lots of questions like that? Can you help me find a doctor for my knee pain? Can you help me find a doctor for this, that, other? My mother is unwell. Can you help me find a doctor? 300 million calls a year. I'm like, oh my God, I come from the consumer industries. I can cross-sell. If they call for one thing, I will give them that and I will sell something more to them. I'm in a clinic. Dr. Williams is the head of this clinic. She is the most amazing doctor in that clinic. She takes care of Medicare patients, and I am saying, I'm going to use my engineering and my tech skills to help her with AI to help her treat patients better. She'll be able to diagnose diseases, predict diseases, cure them, be fantastic. And I said, Dr. Williams, tell me the most difficult part of your day, and I am going to help you with my AI. And she looked at me straight in the eye and said, my most difficult part of the day is you. Steel spectacles, I still remember them every time. And I said, what do you mean? She said, before you put AI in, the Wi-Fi doesn't work at one end of the clinic. I can't log into the system, walk with the patient to that end of the exam room, then I lose my connection, I get logged out. Can you solve, before you go AI on me, can you solve my Wi-Fi connection at the corner of the clinic? I can't use my tech anymore. Maybe Wi-Fi, but not like AI tech. Is a skilled nursing home in Nashville. This is where patients after surgery, especially elderly patients, go into a rehab center. I don't know if you have elderly family members or relatives who go into rehab after surgery. So this rehab center takes care of patients. I walk in just as an observer along with Nurse Susan. Nurse Susan takes me to Miss Smith. Miss Smith is 85 years old, and she is about to get a rehab plan for her knee surgery. And I have an AI program which my team has developed, and I'm going to tell Susan to tell Miss Smith that in 16 days, I predict, I can see the future with AI. In 16 days, my machine learning programs tell me that Mrs. Smith will be able to walk through the hallway, and in 16 days, she will be cured and free to go home. This is AI at its best.
You know, what we are saying is that every industry is talking about AI. right? As if it's a magic wand. Yeah. And then everybody is talking about AI coming at a cost. So are we looking at an industry which is only with the privileged few, or how do we make AI accessible for all without worrying about how it's going to reach the last mile, how it's going to reach grassroots? In true sense, how can AI be the magic wand?
So first, thank you for having me here and CNBC and IIT Delhi. I was here in 1993 to 97, so a long time
Wonderful.
back, but it's great to be back. So yeah, to answer the question, I think to me, AI is the only way we can get there, in fact, right? So I was talking to some of our colleagues, radiologists in our enterprise imaging group, and they mentioned that not just in like India, where sometimes second-tier cities or villages, you don't have access. In Africa, there are countries where there are 2 radiologists who can read mammograms for a country of, let's say, 50 million people. Now, out of 50 million, let's say half are women, and maybe 20% of them require mammograms every 3 years. Right. There's just no access. Yep. So AI is really the only way you can get there, right? So how does AI help? AI can help by first, reducing the time that a physician takes to do something, or taking out cycle time in a process between payers and providers, or between patients and providers. Right. It can provide insights, as Sandeep mentioned, in terms of either medical insights being provided at the point of care, or even helping a nurse or a care manager look at the history and say, hey, you're going to visit this patient at home. These are the questions you should ask. These are the things you should do. So that's at least, I think, the way we think about it, that AI is going to be integral to every healthcare process, every interaction. The other thing I want to mention is the responsible AI piece of it, which is how do you make sure that it doesn't increase disparities and stuff. So we are actually, even before ChatGPT hit and stuff, UnitedHealth Group actually set up a responsible AI program. And it's not just a technology thing, it's a compliance thing, it's run independently. So there's an AI review board that basically makes sure that any AI technology that goes into production and is being used is done so that it's accurate, it's safe, and it's fair. And it could be very simple things. They will not look at just the AI, but let's say you've built something that only works on certain mobile phones, then not everybody has access to those. So you have to make sure that you're providing it in different ways and making sure that anybody who will interact with the healthcare system will be able to take advantage of what AI offers.
With AI advancing at such a fast rate, how do we plan on implementing it in the healthcare system?
So say more. When you say with AI advancing so fast, how do we plan to implement it? Meaning, I mean, how do we want to keep track of its fast moving?
Like, how is it going to work in the future?
I think what, if I'm understanding it correctly, it's one of the questions that always comes up, that tech is moving faster than we are thinking. Before we think about a problem solved by the tech, and also the complication arising out of it. So how do you keep a tab on the multiple sort of inventions that are happening, and what are those inventions that we want to necessarily align ourselves with, and perhaps the complications coming out of it? Can we keep up with this kind of tech?
Yeah, I mean, the short answer is you cannot.
Yes.
Right, and it changes. But what you can do is you can set up sort of systems of maturity, right? You can set up tests, which we have done, right? That for certain things, if the technology is mature, right? So like technology or AI being used in the call centers to record the conversations, that's now mature. So 64 million, 100 million this year, right? But there are areas like AI as nurses, not mature. So we continue to do those experiments. We have a full test bed against that. And we also have a measured process, right? So I talked about the AI review board and everything. But the other thing we do is we have this sort of 3-stage gate. We say, is the POC working, right? That means at least there is some proof that the technology works. Next stage is pilot. So you actually do either a shadow launch or you test it live and you have people using it, because then you get feedback about what's the impact, what's the change management you have to do around it. And if that's going well, then we say, okay, let's scale it.